The 2023 report from Mental Health America has once again ranked Texas as the last state in the country for access to mental health care. KVUE's Pamela Comme joins us once again. Pamela, you spoke with some experts about the data and why we ranked last. Good morning.
Good morning, Yvonne. Yeah, the report looked into things like access to insurance, treatment, and special education. Texas' high rates of uninsured people are one of the reasons why many can't get the care they need. Workforce shortages also play into the low ranking. The director of NAMI, Greg Hench, says there simply aren't enough mental health professionals in Texas. And about 2/3 of the counties in the state don't have a single psychiatrist. The Texas Tribune reports this will only worsen as therapists, psychiatrists, and psychologists head toward retirement, and there aren't enough graduates coming out of college to replace them. Hench says one solution is to draw more people in by investing in the mental health workforce.
We should be raising the reimbursement rates for mental health professionals. We're not going to be able to attract a good base, a good supply of mental health professionals when people can make more in the oil patch, or even in some cases making more working at Walmart.
And as people overcome the stigma of mental illness, demand has increased. Integral Care, Travis County's mental health authority, feels the strain. They've received an increased number of calls since the pandemic and even more with recent winter storms. The good news is people are asking for help, even those who wouldn't have reached out before for services. So remember, if you do need help, there is help available. You can just call 988, the suicide crisis hotline that's available 24/7. Yvonne?
He brought up a good point. He said not only do we need good therapists, and psychiatrists, but really well-versed ones. You know what I mean? You don't just want them, you want them to do a good job because they really have to help people.
Of course, yeah, they definitely have to understand what people are going through. And of course, the more experience, the better they know, I guess, how to deal with certain mental illnesses.
Yes, thank you so much, Pamela.